Hi there. Welcome back. I'm Dr. Satish Babu, your friendly neighborhood neurosurgeon practicing neurosurgery at the Brain and Spine Intervention Clinic in Bangalore. Today, I'm back with another common neurological issue seen in the general population. Today, I will be talking about the carpal tunnel syndrome. The carpal tunnel syndrome is one of the most common problems affecting the hand and the wrist. This is a common condition that causes pain, numbness, tingling, and weakness in the hand and the wrists. It happens when there is increased pressure within the wrist on a nerve called the median nerve. The small finger is typically not affected. Does the carpal tunnel syndrome only happen to office workers or heavy duty factory workers? This is what is there in everybody's mind. Well, it affects people who use their wrists and hands repeatedly at play or during work. Any person practically can get carpal tunnel syndrome, but it's quite unusual to get before the age of 20 years. The chance of getting the carpal tunnel syndrome increases with the age. And it's also important to be noted that the carpal tunnel syndrome is more common among women than men. Then, who is at risk for the carpal tunnel syndrome? People at risk for the carpal tunnel syndrome are those who do activities or jobs that involve a repetitive finger and the wrist use. Many other factors can also contribute to the development of this carpal tunnel syndrome. These factors can be hereditary because some people are born with smaller carpal tunnels which runs in families, hence there's less space for the median nerve. Pregnancy, patients who are on hemodialysis, people who have wrist fracture and dislocation, hand or wrist deformity, arthritic diseases such as gout and rheumatoid arthritis, hypothyroidism in particular, diabetes, chronic alcoholism, and an occurrence of a small tumor within the carpal tunnel. Older age and people who have abnormal protein deposits in the wrist can also develop carpal tunnel syndrome in the near future. Well, how is carpal tunnel syndrome treated? Is surgery always necessary, or is there any other way other than surgery if symptoms can be controlled? Well, carpal tunnel syndrome can be treated in two ways, non-surgically or with surgery. Obviously, there are pros and cons to both approaches. Typically, non-surgical treatments are used for less severe cases and allow people to continue with daily activities without interruption. Surgical treatment can be of much use in patients who have very advanced disease, and they do generally have a positive outcome. Non-surgical treatments are usually tried first when the symptoms appear. Treatment generally begins with wearing a wrist splint, especially at night, taking non-steroidal anti-inflammatory drugs, obviously after a prescription from your attending physician, and injections of cortisone. Most people do get some relief initially, and surgery is not generally needed. Other treatment focus is to be done on a change in the environment to decrease the symptoms. This is often seen in the workplace, where you can do some modifications to help with the carpal tunnel. These changes might include raising or lowering your working chair, moving your computer keyboard such a way that the wrist is free, changing your hand or wrist position while you're doing certain activities, using recommended splints, some mild exercises and heat treatments with the help of a hand therapist can also alleviate symptoms to a large extent. The surgical treatment is generally recommended when the carpal tunnel syndrome gets worse in spite of non-surgical treatment, or the patient has presented with already an advanced stage of the disease. The goal of the surgery is to increase the size of the carpal tunnel in order to decrease the pressure on the nerves and tendons that pass through the space. This is done by cutting or releasing the ligament that covers the carpal tunnel at the base of the palm. If you have a surgery in such patients, you can expect to have the procedure being done as an outpatient procedure or a daycare procedure, but generally a regional or a local anesthetic is injected so that the hand becomes numb and then the surgery is done easily. In some cases, if the person is anxious, the anesthetist may give you some IV drip so that you go to sleep and take a brief nap, and by the time you wake up, the procedure is over. You will have your stitches generally removed between 10 to 14 days after the surgery when the healing is good. The hand and the wrist used for daily activities is gradually restored by using specific exercising programs which the physiotherapists will advise you. Well, this is where the carpal tunnel is situated. There is somewhat like a tunnel kind of a thing through which the median nerve travels. And if there is some degree of compression in this place, the median nerve would get compressed and then lead to symptoms like tingling, numbness, and some degree of weakness in grip. So your surgery also is done in this place where a small incision is done, and then the ligament that is compressing and then making the tunnel smaller is either cut or released so that the nerve becomes freer and the symptoms gradually disappear. And most often the question that is asked to the surgeon is, what is the success rate for the carpal tunnel syndrome surgery? Well, surgery for carpal tunnel syndrome has a very high success rate. It's about 90 to 95%. Many symptoms are immediately relieved, just like tingling sensation in the hands which was there preoperatively, or waking up at night due to the pain. These are symptoms which will definitely improve in many of the patients. However, numbness may take a longer time to be relieved because there has been a degree of compression for a long time. So it may even take up to 3 to 4 months. Well, this is it about a very common problem which is seen among the general population, the carpal tunnel syndrome, where you have a non-surgical treatment, also a surgical treatment, and in spite of surgery, you really do well. So in case you have any symptoms of the carpal tunnel syndrome, it is important for you to contact your attending neurosurgeon, and he would probably do the needful and then make you asymptomatic and get back to your daily activities at the earliest. I will be back very soon with another neurological issue and discuss about the particular topic in detail. So until then, bye from me.